Mr President, you are more likely to die from a range of preventable and treatable diseases if you live outside of Adelaide, and it's unacceptable. South Australia has one of the lowest subsidies available for patient-assisted transport schemes in the nation. Today I have brought through a motion to this council to recognise that we need an immediate review of our ineffective patient-assisted transport scheme. PATS aims to support patients travelling long distances for medical treatment financially. This assistance covers transport costs such as fuel and accommodation. Mr President, more than 13,000 South Australians received financial support last year through the scheme, highlighting how many people rely on it. In 2013, Dr David Philby independently reviewed the patient-assisted transport scheme, and he found many issues with the framework at the time, including the fuel and accommodation rate subsidies, support for carers, access to health services and the appeals process. On the 31st of May 2022, I asked the Attorney-General about when increased rebates were due to be increased. I was told that there were no current plans to change the PATS scheme and it would be considered over time. In January 2023, the Malinowskis government did double the fuel allowance from 16 cents to 32 cents per kilometre travelled. And while this was met with a positive reaction, the truth is that it was the first significant increase in the PATS scheme in more than 20 years. South Australia has comparatively the lowest subsidy rate in the nation, particularly with accommodation. This state offers $40 for singles and $80 for couples if they travel more than 100 kilometres. All other states provide much higher rates for both singles and couples, with subsidies well over $100. If you're after a second opinion on your application, the PATS scheme leaves little to be desired. For example, the term medical specialist appointment causes uncertainty regarding coverage for pathology and diagnostic testing, and the lack of clarity leads to payment inquiries. If the patient is still not satisfied with their determination, they can turn to other departments or local MPs to advance their claim. This just adds another layer of red tape and bureaucracy to something that is easily avoidable. There is a strict interpretation of support carers and escorts in the scheme, and to be eligible as a carer or escort, you must be deemed medically necessary by the referring GP or a specialist. This overlooks the emotional and social support of the patient and makes it harder to travel to required appointments, especially if they are already ill or frail. In the South Australian scheme, patients can only receive subsidies for medical specialists, which excludes coverage for GPs and allied health professionals. This results in a significant gap in healthcare services, potentially leading to missed opportunities for improved health and wellbeing outcomes. As a result, some won't access preventative healthcare due to the costs involved. The success of the PATS program relies on the collaboration of all involved stakeholders, including government bodies, healthcare providers, transport services and rural communities. Advocating for the expansion and improvement of the scheme is crucial to ensure accessibility, efficiency and responsiveness to the changing needs of South Australians.